The time is just gone 15 minutes past 9 a.m. as we continue with the show this morning. Now, the second half of the show, shortly, we will be joined by Mohamed Hoosen Suleman, and we are talking about the digital COVID-19 vaccine certificate. And as we stay in the company of our Salam Media listeners on the various platforms of Salam Media, also Al-Ansar, Durban, and in Pietermaritzburg, and also joining us right now is One Nation 88.9 FM out of Polokwane. We welcome you to the show. But time now to go across to be joined by third-year medical student Mohamed Hoosen Suleman. Mohamed, assalamu alaikum wa rahmatullahi wa barakatuh, and welcome.
Wa alaikum salam. I hope you and the listeners are well.
Alhamdulillah, we're doing well. And obviously, we've seen South Africa now launching what is called a digital COVID-19 vaccine certificate with a QR code. Now, before we speak about the digital vaccine certificate, if you could just share with us your assessment on how the COVID-19 vaccine rollout is currently being conducted.
Globally, the vaccine rollout, it seems to be going well. In my assessment, many European countries, they have vaccinated more than half of their population. In fact, over 6.3 billion doses have been administered worldwide. But so there's something that is disappointing and perhaps unsurprising is when you look at the African continent, it's just less than 5% of the population have been fully vaccinated. South Africa in particular has achieved a mere 15% of the population fully vaccinated. There's no doubt that we'll reach nowhere near our target of our vaccination of approximately 70% of the population by end of the year. So in the country, we are currently vaccinating about 150 to 180,000 people per day. We have capacity to vaccinate up to 400,000 every day. We need to take the vaccination program into our rural settings. We need our community workers to assist on the front line on the ground. We need to address vaccine hesitancy, and we have to continue with advocating for the vaccine acceptance.
Yes, obviously Africa, the African continent is of major concern at this point in time, as you have pointed out, Mohamed Hoosen. But, Africa always known as a dark continent as well. And, we know that there are economic issues, there are financial issues as well. But hopefully we can we can make a lot more progress with regard to the vaccine rollout on the continent. But let's talk about the vaccines themselves now. Currently, the vaccines that are being used, just in terms of efficacy and just to check on how effective, are they still effective against COVID-19, taking into account that there are new variants, and in particular the Delta variant, which is dominating many parts around the world, Mohammed.
Vaccine efficacy, it's still maintained at high levels with just slight reductions. Let me explain. We know that the Delta variant, it is dominant in South Africa and has completely replaced it was the Beta variant.
The Beta,
in fact,
yes.
The World Health Organization, they have reported that the Delta variant is the dominant variant across the globe. So in South Africa, we are using the Johnson & Johnson and the Pfizer vaccines. Now, the J&J single dose, it has shown an efficacy of approximately 60%. Now, the company, they've just released its data from a clinical trial showing that vaccine efficacy jumping to 90% after a booster shot. So we would soon see a second dose of the J&J being administered. Pfizer, on the other hand, has shown an efficacy of approximately 74% after the second dose. A third dose of Pfizer boosts the immune response even better. So these vaccines are indeed effective. They are saving lives. And I think that um, that with time the immune protection may subside slightly, but that's when we get these um, it's these booster shots that that would come in.
Yes, and interesting that you mentioned vaccine hesitancy, because I think that is one of the reasons why people are hesitant is they still are not convinced in terms of what the vaccine is doing or what the vaccine is not doing. And from what you're just saying, and you mentioned the efficacy, and you're talking about 90% on the Johnson and Johnson, 70%. So we are starting to get a lot more information on what the vaccines are doing and how effective they are now, Mohammed.
Yes, absolutely. But I think it's important that for people who have received the jab, they should come out to share their experience, because the vaccine hesitancy, it's fueled by a lack of information, by a lack of knowledge of the general public. And I also think that we um, as the healthcare workers, we have a responsibility to speak on on that evidence-based information, on the clinical trials that have proven for the vaccine to be safe and to be effective.
Mm. Well, certainly. Now, let's talk about the Minister of Health, and we've heard about the announcement that has come through with regards to the implementation of the digital COVID-19 vaccine certificates with QR codes. Now, firstly, do you support the digital vaccine certificate policy?
Yes, absolutely. It's actually a recommendation from the World Health Organization. WHO, they've released these guidelines on the 27th of August in an 80-page document, and they've outlined how countries should implement digital vaccine certificates. So it's a tool to track who has been vaccinated, and it could also assist um, with the vaccine uptake. Many people will now realize and appreciate the freedom that comes with vaccination, and so more people will be likely to take the vaccine. I think it's a move in the right direction.
Yes. Now, just how exactly will this digital certificate work, and also how does one go about getting this certificate?
So the vaccine certificate will be used in future, for example, to gain entry into certain places, sports events, or the entertainment uh, uh, places, or also for traveling. Now, the system, it was launched yesterday by the Department of Health. There are issues currently with the system that the department is attending to. So, in terms of process, you simply go onto the website, you you enter your details together with your ID number and your EVDS code, and then OTP will be sent to your cell phone. This is to verify that it's actually you. Once you enter that OTP, then your vaccine certificate will be generated. Now, so the QR code that will also be created by the system, it is of course unique to each person. And so certain entities or businesses will require for you to show your QR code. And they simply scan it with a QR scanner, and it will show them that you have been vaccinated. So essentially, that's how it's planned to work.
Yes. Now, we know South Africa is a country that is riddled with inequalities. And the reason why I am raising this question is, do you think the implementation of the digital vaccine certificates will in some way be discriminatory against people or marginalize those who do not have access to smartphones? And here we're talking about, we have a huge rural landscape in the country, Mohammed.
That's a very good question, and it's a sensitive issue. And I think that if we have a good implementation plan, then we could overcome that risk of discriminating, as you say, against others. Because for those who can't afford a smartphone and they are vaccinated, so we ought to accept that physical vaccine card as a way for them to show that they are vaccinated. It's just that that a digital certificate, it's preferred due to saving time, and it's more efficient because it's online, it's on a database. So, but of course, I think that provisions have to be made for those who are unable to produce that QR code and them wanting to access facilities.
Yes, and just finally, Mohammed, we've heard all this talk about the fourth wave. Do you think South Africa will be experiencing a fourth wave of COVID-19, and also measures? We know we're going to be in a holiday season. People are going to be mixing a lot more, and measures that could be taken to avoid this.
That's a key question. I think we may very well experience a fourth wave, given that we will not achieve our vaccination target by the end of the year. We know, so we know the nature of how this virus works. It's been with us for almost 2 years now, and we know that it works in waves or in cycles, in that every 4 to 5 months, we'll see a new wave of infections. And so from this, we can predict that that we could experience a new wave within 2 to 3 months. But being cognizant of the fact, and I think it's important, and I should emphasize, that we have many people that are already protected, either from natural infection or from vaccine-mediated immunity. So we probably won't see a lot of severe disease and hospitalization, because the burden on our healthcare system will not be as severe as we had previously seen. So I think if we strictly comply with our health and safety protocols, together with our increasing vaccine coverage, we may not experience a severe fourth wave.
Well, Mohammed, Jazakallah, as always, for coming on and talking with us and providing us with that update. We wish you all the best, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Mohamed Hoosen Suleman joining us this morning, providing us with an update, particularly looking at those digital vaccine certificates for COVID-19. The time is just gone 9:28 a.m. We're going to go for a break. We'll be back.